Hello, Delegate Ann Farrell-Tata and esteemed board members. My name is Arlene De Los Reyes, and I am a family nurse practitioner student at Old Dominion University and have been practicing as a registered nurse for the last 9 years with a background in med-surg, cardiac, ER, and case management. My colleagues and I stand before you today to bring Senate Bill 4286, the Comprehensive Addiction Resources Emergency Act of 2024, to your attention. This bill will provide emergency funding to states, territories, and tribal nations to improve access to treatment, prevention, and recovery services for individuals impacted by substance use and mental health disorders. With rising overdose rates and overwhelmed healthcare systems, now is the time to act. The passage of this bill will directly improve lives and save communities. My colleagues, who work on the front lines of healthcare, will now share their personal experiences and insights on how this bill will make a significant impact. Madisyn Eppleman will address the opioid and stimulant addiction crisis and the need for critical support for individuals and families impacted by substance use. Layney Duncan will address the challenges individuals face when seeking addiction treatment in emergency rooms, and how increased support can improve access to care and eliminate financial barriers for those in need. Kristen Darragh will share her firsthand experience caring for newborns affected by substance withdrawal and highlight the urgent need to support both individuals battling addiction and the innocent children caught in its devastating cycle. And finally, Britt Chapman will discuss the growing crisis of neonatal abstinence syndrome and urge support for expanded access to overdose reversal drugs, improved treatment options, and efforts to break the cycle of addiction for future generations. We thank you for your time and consideration.
Good morning, Delegate Ann Farrell-Tata. My name is Madisyn Eppleman, and I've been an ER trauma nurse for the past 2.5 years. I'm currently enrolled in Old Dominion University's Family Nurse Practitioner program. I stand before you today to encourage support for Bill S. 4286, also known as the Comprehensive Addiction Resources Emergency Act of 2024. This bill is a direct response to the growing substance use epidemic that has taken a devastating toll on communities and families across the United States. Substance use, primarily opioid and stimulant addiction, has reached its peak epidemic levels in the United States. According to the Centers for Disease Control and Prevention, over 100,000 Americans have died from drug overdoses in the last year alone, with opioids contributing to the majority of those deaths. This is almost 2 times the amount of deaths since 2019, with an estimated 50,000 deaths back then. These deaths include those of mothers, fathers, brothers, sisters, best friends, and close relatives. This bill directly addresses the urgent need for comprehensive, multi-pronged approach to combat the crisis. The grant funding authorized under this bill will provide a wide range of vital resources, including harm reduction programs, early intervention efforts, and core medical services. Furthermore, it ensures that financial barriers are minimized by providing assistance for health insurance coverage, making treatment more accessible to those who need it the most. As a current ER nurse, I can confidently say and attest to the financial and emotional toll that substance use has on both the patient and the family. Unfortunately, addiction can be a tough illness to crack because at the end of the day, it is entirely in the hands of the patient and dependent on their desire to improve. With support of this bill, we hope that we can save a few more lives by creating pathways to recovery and empowerment for those affected by addiction, while also supporting them financially. The time to act is now. Let's give communities and families the resources they need to confront the addiction crisis at hand. Let's do so with urgency, compassion, and focus on lasting recovery. Thank you for your time and consideration support for the Comprehensive Addiction Resources Emergency Act of 2024. You will now be hearing from my fellow colleague and coworker, Layney.
Thank you, Madisyn. Hello, Delegate Ann Farrell-Tata. My name is Layney Duncan, and I have been an emergency room trauma nurse for the past 3 years. I am also a family nurse practitioner student at Old Dominion University. I am speaking to you today to ask you to show your support for Senate Bill 4286, which addresses the current public health crisis that is addiction. In my time as an ER nurse, I have seen the effects addiction has on individuals and their families daily. Very commonly, family members bring their loved ones struggling with addiction to the ER for help. As you can imagine, the ER is a very loud, chaotic place and not always the best place for patients going through withdrawal. Unfortunately, due to capacity, many individuals struggling with addiction spend days in an ER hall bed waiting for placement for treatment. Sitting in the ER for days causes many of these individuals to leave without proper treatment. Individuals seeking treatment need better access to proper care. Paragraph 5 of this bill discusses support services such as recovery housing, a crisis hotline, childcare for individuals receiving treatment, and more. Funding for these services will allow individuals to obtain proper treatment in a faster manner rather than going through the ER. Currently, if an individual wants to seek inpatient treatment, the ER is the most common pathway. If there is more funding to support having a wider variety of treatment centers, it'll make it easier for individuals to walk into centers and sign up for treatment, bypassing the ER. Easier access to treatment will hopefully encourage individuals struggling to seek help. As previously discussed by my colleague Madisyn, this bill also aims to eliminate financial barriers individuals face when seeking treatment. Treatment can be very costly. Addiction very commonly also takes over one's life and affects their ability to work and maintain a job. Ensuring these individuals have access to insurance coverage is important to reducing financial strains seeking treatment may bring. Having lost a family member to addiction myself, I have seen firsthand the toll it takes on an individual. Addiction is a disease and should be treated as such. I ask you to show your support for Senate Bill 4286, which would demonstrate your commitment to addressing this public health crisis and help individuals who are suffering daily. Thank you for your time.
Thanks, Lainey. Good morning, Delegate Ann Farrell-Tata. My name is Kristen Darragh, and I'm currently a pediatric nurse practitioner student at Old Dominion University. I'm also a neonatal intensive care unit in downtown Baltimore, where addiction rates are alarmingly high. Every day, I care for some of our most vulnerable patients, some of which are newborns who, through no fault of their own, begin their life in substance withdrawal. These tiny, innocent lives enter the world already suffering, dependent on substances that they were exposed to in the womb. Watching a newborn tremble through withdrawal is so heartbreaking. Their cries are different, high-pitched, distressed. Their bodies are tense. They struggle to eat, to sleep, to be comforted. And while we do everything that we can to support them in the NICU, the reality is that their life and their challenges don't end when they leave our care. For many of these babies, the road ahead is uncertain. Many return to unstable environments where addiction continues to be a daily struggle. Others enter the foster care system, carrying long-term physical and emotional impacts of neonatal abstinence syndrome. Many will grow up facing an uphill battle against the very cycle that brought them into this world. That's why we need real solutions. We need support for Senate Bill 4826, not just for those battling addiction, but for the innocent children caught up in its grip. Supporting this bill isn't just about policy, it's about people. It's about giving these babies a fighting chance. It's about strengthening families, preventing future generations from suffering the same fate, and addressing addiction at its roots. I urge you to support this bill for my patients, for their families, and for the future that we all want to build. Thank you.
Thank you, Kristen. Delegate Ann Farrell-Tata, I stand before you as a student in Old Dominion University's Neonatal Nurse Practitioner Program and a bachelor's prepared registered nurse in the Neonatal Intensive Care Unit, a place where I care for the smallest, most vulnerable patients. I urge you to pass the Senate Bill 4286, the Comprehensive Addiction Resource Emergency Care Act, because I have seen firsthand how the substance use crisis is harming newborns, their families, and our healthcare system. Each day, I care for babies born with neonatal abstinence syndrome, or NAS, a withdrawal condition that occurs when an infant is exposed to opioids and other substances before birth. These newborns suffer from tremors, seizures, difficulty feeding, and constant cries of discomfort. Their first days, weeks, or even months of life are spent in withdrawal, hooked up to monitors and receiving withdrawal medications instead of being home with their families. This crisis is growing, and we need real solutions. The CARE Act provides critical measures to combat this crisis, and I want to highlight 4 key provisions. The first provision is expanding access to opioid overdose reversal drugs. The bill directs the Department of Health and Human Services to establish a program that purchases and distributes opioid overdose reversal agent drugs to states and tribal governments. By making these medications more available, we can reduce overdoses and prevent infants from being exposed to opioids before birth. Secondly, As discussed by both Layney and Madisyn, this bill provides grants to high-risk communities. The bill funds grants to states, tribes, and localities facing facing high drug overdose rates. These grants will support prevention, treatment, and recovery, ensuring that the hardest hit communities get the resources that they need most. Additionally, the bill allows for the development of innovative treatment models. By supporting innovative treatment models, we can improve access to evidence-based treatments, ultimately helping more individuals and families break the cycle of addiction. Lastly, it pushes for the expansion of Medicaid provider capacity. Many of the families I work with struggle to access addiction treatment due to financial barriers. The CARE Act will expand Medicaid provider capacity, allowing more individuals to receive treatment earlier, before their substance use affects the unborn child. As a NICU nurse, I want to care for fewer babies suffering from withdrawal. I want to see mothers get the treatment they need before their pregnancy. I want our healthcare system to be proactive, not just reactive. The CARE Act is a necessary step towards addressing the crisis at every level: prevention, treatment, and recovery. I urge you to pass this bill and protect the innocent babies who are unable to protect themselves. Thank you.
On behalf of myself and my colleagues, thank you, Delegate Ann Farrell-Tata and board members, for your time and consideration. We deeply appreciate your attention to this critical issue, and we hope you will lend your support to help us make a meaningful impact in the fight against substance use disorder. S 4286 is a critical step toward addressing the substance use crisis and ensuring that those affected have access to the treatment and resources they need to recover. Your support will make a real difference in the lives of countless individuals and families who are struggling with addiction. Thank you for your time.